This segment of DelmarvaLife is sponsored by TidalHealth.
For so many people, a weight loss journey can feel like a revolving door of diets, quick fixes, and frustration. And that seems to ring particularly true during the holidays. But the problem isn't always a matter of willpower. And it's important to recognize that there's no single solution that works for everyone. So how can we stay on track without giving up those foods that make this season so special? Helping us tackle that problem is Alessandra-Anna Monaghan, a family nurse practitioner with TidalHealth. Allie, welcome.
Thank you so much for having me.
So let's start off, as we kind of alluded to, weight loss is not a one-size-fits-all. So how does TidalHealth create personalized plans for patients?
So our initial appointment with patients is a very important appointment that we have, and that is where we discuss that obesity is a chronic disease, and there are many risk factors that can lead to obesity, such as hormonal reasons. Also, it could be a medication that the patient may have been on or is currently on, stressful situations, and also eating disorders. And from that history, we then develop a tailored plan, and we utilize our many resources such as nutrition. We have bariatric surgery. We also have medical weight loss with the medications that everyone hears about now, and also exercise when appropriate.
Okay, so let's break that all down a little bit. Many people, of course, try the diets, the quick fixes. How is medical weight loss at TidalHealth different from those traditional methods?
Medical weight loss at TidalHealth is different from those methods because we try to focus more on a sustainable way to lose weight. Some of those diets can be very restrictive and hard to maintain, but we focus more on changing the habits of patients. And then we also have many resources available to those patients, such as the doctors, nurse practitioners like myself. We also have bariatric surgeons and exercise specialist and nutritionist.
So does that mean whenever you prescribe a plan and we walk out the door and try to execute it, there is support for us from the experts?
Yes, there is support all along the way. We help develop a relationship with these patients, and we create a tailored plan to fit that patient's needs. We also educate the patients along the way. We have regular check-ins to help that they feel supported and help maintain that weight loss.
And of course, you mentioned medications and other therapies used in these plans. How are they safely integrated into the plan?
So yes, medications are integrated when appropriate. We do monitor those patients very closely to make sure that it is safe for that patient. And actually, the FDA has approved these medications for other comorbidities or chronic conditions that are related to obesity, such as heart disease, non-alcoholic fatty liver disease, also type 2 diabetes, and sleep apnea. And the World Health Organization actually recommends that when you utilize these medications, it is best to pair these medications with nutrition, behavioral modifications, and exercise when appropriate.
Yeah. Okay, so sometimes you have to transition from medical weight loss to surgical solutions. How do you make that transition?
So we actually work in the same office as the bariatric surgeons. So if a patient decides yes, I do want to have bariatric surgery, we then refer them to a surgical seminar, which is where the surgeons discuss the different types of bariatric surgery that we offer. And then from then on out, we still work with the patients, all of us together, but we help with the nutritional aspect.
Sounds like a winning combination right there.
Thank you.
Alessandra-Anna Monaghan with TidalHealth, thank you so much for coming in.
Thank you for having me.